Welcome. At some time in their life, 1 in 3 individuals will be diagnosed with cancer. Did you know that? This figure is more than simply a figure. It serves as a sobering reminder of how common this illness is in contemporary society. Cancer continues to rank among the world's top causes of mortality, despite advances in medical knowledge. Even more concerning is the frequency with which the early warning indicators are disregarded or overlooked. Not because there is a lack of access to healthcare, but rather because the tiny cues our bodies provide us are often disregarded or written off as minor annoyances. Innumerable instances are identified too late each year. When certain tumors are detected early, especially at stage 1, survival rates may surpass 90%, according to the American Cancer Society. However, those percentages often fall to less than 20% as the illness advances to stage 4. The significance of early detection is shown by this startling discrepancy. Still, a lot of individuals are ignorant of the tiny indications that might save their lives. I want to focus on 8 little but important warning indicators that often occur before a cancer diagnosis in this conversation. The majority of patients do not link the condition with obvious signs like severe weight loss or a chronic cough. Rather, they are the subtle, disregarded cues, things we often reject as stress, age, or minor health irritations. The difference between identifying cancer early and having to fight a much harder battle later might be determined by recognizing these symptoms. I recognize how normal it is to be wary or even doubtful. A lot of false information and even alarmist health information may be found on the internet. When possible symptoms are mentioned, it's simple to fret about every pain and discomfort. However, this is not about inciting needless dread. In order to identify cancer in its earliest and most curable stages, thousands of patients have relied on warning signals that are supported by medical science and study. My goal here is not to alarm you, but to empower you. By understanding these subtle indicators, you can approach your health with confidence, knowing when to seek professional advice. Ultimately, this knowledge could save lives, helping you or someone you care about act in time to make a meaningful difference. Let's dive in. The first warning sign to be aware of is persistent bone pain. Unlike the fleeting aches caused by a long day or a minor injury, cancer-related bone pain tends to intensify over time. This pain often worsens at night, disrupting sleep and making it impossible to ignore. For instance, bone cancer, such as osteosarcoma, affects the structure of the bone itself. The resulting discomfort may initially feel like a sprain or muscle soreness, but gradually becomes more intense, often affecting the long bones of the arms and legs. This type of pain may also be accompanied by swelling, reduced mobility, or even fractures without a clear cause. If you experience persistent bone pain that interferes with your daily activities or doesn't respond to standard pain relief methods, it's essential to consult a doctor. Early diagnosis can lead to more effective treatment, improving both survival rates and overall quality of life. Another critical yet often overlooked symptom involves changes in the eyes. Your eyes are windows into your overall health and can sometimes reveal early signs of cancer. Ocular melanoma, a rare but serious type of cancer, is one such example. This condition may manifest as unexplained visual disturbances, persistent irritation, or changes in the appearance of your eyes. For instance, you might notice a growing dark spot on your iris, flashes of light unrelated to migraines, or blurred vision that doesn't improve with a new prescription. These symptoms may seem minor at first, but they should never be ignored. Routine eye exams can help detect abnormalities early, especially if you're at higher risk due to factors like fair skin, lighter-colored eyes, or excessive sun exposure. Advanced imaging techniques, such as ophthalmoscopy, Allow healthcare providers to examine the inner structures of your eye, potentially catching ocular melanoma before it progresses. Remember, early detection doesn't just improve survival rates, it can also preserve your eyesight. If you have a family history of eye cancer or spend a lot of time in the sun, regular checkups are even more critical. Chronic eye discomfort or changes in vision are not normal and deserve immediate attention. Stay with me as we uncover more of these subtle warning signs. The goal isn't to overwhelm you with information, but to equip you with practical knowledge that could one day make all the difference. Recognizing these signs is the first step in protecting your health and the health of your loved ones. Knowledge truly is power, and in this case, it could save lives. Rash on the body. When it comes to dermatological alterations, certain types of rashes should never be dismissed, as they can indicate underlying health issues that require immediate medical attention. While many individuals may wrongly attribute unusual skin symptoms to common conditions, the presence of a rash can sometimes signal something far more serious like leukemia, a malignancy that disrupts the body's ability to produce healthy blood cells. Leukemia, which primarily affects blood-forming tissues such as the bone marrow and lymphatic system, can present itself through distinctive skin manifestations. One of the most notable types of rashes associated with leukemia is petechiae. These are tiny round spots on the skin that appear due to a deficiency in platelets, the cells responsible for blood clotting. In individuals with leukemia, platelet insufficiency can prevent proper clotting, causing small capillaries, tiny blood vessels, to leak blood into the surrounding skin. Unlike common rashes, petechiae are non-blanching, meaning they do not fade or disappear when pressure is applied. Typically, they range in size from 1 to 2 millimeters in diameter and may appear as red, purple, or brown spots. They often manifest in areas where pressure is exerted on the skin, such as the ankles, the insides of the arms, or where clothing may be tight, leading to their clustering in those regions. It is important to note that these rashes do not follow the usual pattern of irritation or healing seen in ordinary rashes. They persist for a longer duration and may even worsen over time. If you notice any unusual rashes that do not seem to go away, or if they appear with other symptoms such as unexplained bruising, bleeding, or a general sense of fatigue, it is crucial to seek medical advice immediately. Understanding the underlying mechanisms of these skin alterations can help you spot potential issues early on, ensuring timely intervention. Leukemia's impact on platelet production causes capillaries to rupture, leading to these characteristic blotches on the skin. Regular rashes caused by common conditions tend to itch and improve over time, while those linked to leukemia tend to remain stubborn and may even be accompanied by other, more serious symptoms. Marks on the fingernails. While most people are familiar with the potential for skin cancer, few realize that cancer can also manifest in unusual ways beneath the nails. Subungual melanoma, a type of skin cancer that develops under the nail bed, can start as what appears to be an innocent vertical stripe on the nail, known in medical terms as melanonychia striata. At first glance, this black line may not seem alarming, but its presence could be an early warning sign of a more serious condition that requires immediate attention. Unlike normal nail discoloration or minor trauma that might cause a streak, malignant streaks associated with subungual melanoma can rapidly change in appearance. They may grow in width, change in color, or become more pronounced over time. The most frequently affected nails are the thumb and big toe, although this type of melanoma can develop on any nail. Early detection is vital because subungual melanoma can be easily mistaken for a fungal infection or nail trauma, especially since the condition often presents without pain or other obvious symptoms in its early stages. Certain warning signs should raise immediate concern. These include the appearance of a streak wider than 3 millimeters, the blurring of the edges of the line, or the development of multiple colors within the streak. Another critical indicator to watch for is the spreading of black pigmentation beyond the nail bed and onto the surrounding skin, a phenomenon known as Hutchinson's sign. This could signify that the cancer has started to spread, making it even more urgent to consult a healthcare professional. If you notice any changes in your nails, particularly in conjunction with symptoms like pain, splitting, or bleeding of the nail, it is essential to consult a doctor as soon as possible. Prompt medical attention can significantly improve the chances of successful treatment if the melanoma is caught early. Unidentified sweats at night. Night sweats are another alarming symptom that should not be ignored. Many people experience occasional sweating at night, often as a result of a hot room or a restless night's sleep. However, when night sweats are recurrent, soak through your clothing, and are not explained by environmental factors, they could be an indication of a serious underlying issue, including cancer. In particular, lymphoma, a cancer of the lymphatic system, is known to cause what are referred to as B symptoms, which are a group of signs that often appear together in individuals with this type of cancer. Night sweats are one of the primary B symptoms, and they are often accompanied by other signs such as unexplained weight loss and fever. This combination of symptoms forms a pattern that oncologists use to diagnose malignancies. The mechanism behind lymphoma-induced night sweats lies in the body's immune system response to cancer. As the cancerous cells in the lymphatic system trigger the production of inflammatory chemicals, the body's ability to regulate temperature becomes impaired, leading to excessive sweating, particularly during the night. This can cause individuals to wake up drenched in sweat, even in the absence of an overly warm room or other environmental factors. While occasional sweating is normal, frequent episodes of night sweats that leave you soaked or disturbed during sleep are concerning. These should not be dismissed as simple issues caused by stress or illness. If you experience night sweats along with unexplained weight loss, fever, or fatigue, it is essential to seek medical advice. Night sweats that are persistent and out of proportion to environmental conditions may be the body's way of signaling that something more serious is at play. Final thoughts. While the symptoms described above, rashes on the body, nail marks, and unexplained night sweats, can sometimes be linked to minor conditions or stress, they also have the potential to be warning signs of more serious health issues, including cancers like leukemia and lymphoma. Early detection and intervention are key to successful treatment and recovery, making it crucial to stay vigilant and aware of any changes in your body. If you notice any of the symptoms mentioned, especially if they persist over time or worsen, do not hesitate to seek medical attention. Prompt diagnosis and treatment can make all the difference, so always consult with a healthcare professional if you are concerned about any new or unusual changes in your health. Your health is invaluable, and catching potential issues early is the best way to ensure a positive outcome. 6. Chronic acid reflux. Medically referred to as gastroesophageal reflux disease, GERD, chronic heartburn may seem to be a minor annoyance. It may indicate something more dangerous, however, if it continues in spite of medicine and lifestyle modifications. Acid reflux that doesn't go away after standard therapy is often the first sign of esophageal cancer. Recurrent damage to the lining of your esophagus is the link between cancer and persistent heartburn. A disorder known as Barrett's esophagus may develop as a result of changes in the cells lining your esophagus brought on by stomach acid over time. Esophageal adenocarcinoma is far more likely to occur in people with this precancerous condition. Watch for warning signals such as unexpected weight loss, food being stuck, or trouble swallowing in addition to your heartburn. It's time to see a doctor if managing your heartburn with over-the-counter drugs hasn't improved after more than 3 weeks. 7. Yellowing of the skin. Jaundice is a condition where your skin and eyes become yellow due to an accumulation of bilirubin in your body. Even though there are many other causes of jaundice, when it appears suddenly in adults, it often raises suspicions of liver or pancreatic cancer. The bile duct may become blocked by tumors in pancreatic cancer, which would hinder the correct processing and expulsion of bilirubin. The bile that enters your system as a result of this backlog turns your skin and eye whites yellow. Usually beginning gradually, the hue shift intensifies as the illness worsens. Because the pancreas is deep within your belly, it might be difficult to identify cancer early. For this reason, it is important to identify jaundice, particularly if it is accompanied by upper abdominal discomfort, black urine, or light-colored feces. 8. Fever. Blood cancer may be indicated by a chronic or recurrent fever that is inexplicable. Fever associated with cancer often follows a certain pattern and may coexist with other systemic symptoms, in contrast to normal fevers that go away in a few days. Frequent fevers may be brought on by leukemia and lymphoma, which cause your immune system to generate substances known as cytokines. In addition to night sweats and inexplicable weight loss, these fevers might strike without any obvious illness. Periodic fever,